Okay. Hi, it's Dr. Mark Bishara again. It's good to see you guys again, or good for you, I guess, to see me. It's been a couple weeks now since you've had your hair restoration procedure. And it's important that you hear this both from our staff and maybe one more time from me. There are a few things that you need to be aware of as you go forward with respect to your newly transplanted scalp. The first is avoiding exposure to UVA. UVA is 10 times more potent to the follicle than UVB. Remember to always protect your head, especially in the first year following your transplant procedure. That is in the form of two different efforts that you can employ, okay? Number one is to wear a hat. Wear a light colored hat. Don't wear a darker black or dark blue. Wear a white or a reflective hat. Those tend to reflect this type of radiation and not have it sort of absorbed, okay? The second thing that you need to do is adopt a type of sunscreen that you can put on every day. My particular favorite is a product called Aerolase that's produced by Alta MD. It's an aerosolized zinc oxide. Anything above 5% is going to give you the maximum protection that you can get from UV. And so the typical way to do this is you get in the shower. When you're getting it ready for the day, you get out of the shower, you kind of you mess with your hair a little bit, you go and get your clothes on, you comb your hair, and right before you leave, you're coming back to brush your teeth, and you go to spray the cologne. That's the moment after you've styled your hair, you've sprayed your hairspray, or you've put your product in. That's when you want to take the aerosolase and you just spray it over the top of your head to protect the grafts. While you're there, a little tidbit, spray your face too. That'll prevent premature aging as well. And so that product is available. If you just call our office, we can drop ship it to you. It's a very small amount, it's $20, $25 for something like that. Okay, number two, avoid nicotine. Nicotine is a vasoconstrictor. You see it in all kinds of things, Nicorette gum included, okay? The 4 gram or whatever it is, that's still gonna kill your grafts. So be mindful of it. Secondhand smoke, hookahs, e-cigarettes, all of the things that might expose you to nicotine are going to be particularly damaging. And I've seen it. I've seen somebody come in who was an avid smoker who had about 60% yield from his transplant procedure with no other reason on why he had that poor yield. And I would consider that a surgical failure if they got 60% growth. So avoid cigarette smoke like the plague. Okay, cigar smoke, tobacco, it all qualifies. So don't ask me, well, what about pipe smoking? Yes, pipe smoking, anything that has tobacco. Pot smoking, right? Somebody asked me, can you smoke marijuana? The issue with marijuana is that most patients, and this is a dose-related phenomenon, who do smoke marijuana, smoke or exposed to marijuana, the carcinogens and the other vasoconstrictors, they're exposed at a much lesser dose because they don't smoke 20 marijuana cigarettes a day. Right? So for that reason, it's usually the dose that makes the poison. So I don't condone cigarette smoking or even marijuana smoking specifically for your hair, okay? And then third thing to sort of look for in the post-operative period, and you want to watch for this in the first several months, you're gonna get pimples, okay? These little eruptions will show up in the areas that we actually did the transplant procedure. They can happen in the recipient bed, but they can also happen in the donor area, whether it's from the beard or from the back of the head. We wanna make you aware that that's normal, okay? Now, if you have 1 or 2 or 3 pimples, get excited because that's a reaction that the hair's having as it's pushing up through, and it means that it's working for you, right? You want to have that. But the minute that you have four pimples at one time, not the 4th consecutive, but the 4 pimples at one time, that's a phone call, okay? I want you to call me for that because a superficial staph infection, particularly caused by MRSA, can be somewhat delayed in onset. You can see it for a couple of weeks after the procedure. And we have good topical antibiotics that we can start you on right away that'll help knock that out or at least keep it at bay until you can get on an oral antibiotic to completely knock that out, okay? So phone call if you get more than 4 pimples in one day, okay? Thanks again for tuning in for the 2-week post-op video. And we look forward to any questions that you might have. Just call the office or talk to one of our concierges, okay? Thank you.